Namaste. Welcome back to Ayurveda Bharati Bhaishajya Kalpana classes with Dr Nayana. Today we are going to study part 3 of Unit 5, that is Aushadha Sevana Kaala in Bheshajaprayogavidhi. Contents of today's class are: what is Aushadha Sevana Kaala? Aushadha Sevana Kaala according to Astanga Hridaya. Aushadha Sevana Kaala according to Sharangdhara Samhita. Comparison of Aushadha Sevana Kaala between different Samhitas. Then modern understanding of Aushadha Sevana Kaala or modern system of medicine Aushadha Sevana Kaala, that is Chronotherapeutics. So we are going to study Aushadha Sevana Kaala in this class. So here we are going to study Aushadha Sevana Kaala. What is Aushadha Sevana Kaala? Aushadha means medicine. Sevana means consumption or administration. Kala means time. So Aushadha Sevana Kala is time of administration of medicine. Before going into the topic, we have to remember a quotation or shloka told by Acharya Varpata. In Sutrasthana, Astanga Hridaya Sutrasthana, first chapter, Ayush Kami Adhyaya, Acharya ji has given the effect of Kala on dosha prabalata. That is, Vayo Ahoratri Bhuktana Te Anta Madhya Adigaha Kramat. That is, Acharya ji has explained how Kala causes harmonic alteration in dosha prabalata. So after remembering that shloka, it is interesting to know how does Aushadha Sevana Kala causes on Roga, Avastha, Dosha Avastha. It will be interesting to know how does Aushadha Sevana Kala helps in curing the diseases. So, we are going to study Aushadha Sevana Kala. Aushadha Sevana Kala plays a major role in the treatment of the diseases. There are 10 to 11 Aushadha Sevana Kalas told in our classics. By following the Aushadha Sevana Kalas, we can achieve targeted action. Our Acharyas have given different Aushadha Sevana Kalas. With the help of these different Aushadha Sevana Kalas, we can treat the diseases. For treating the different diseases, different Aushadha Sevana Kalas are told in our classes. Aushadha Sevana Kalas helps in enhancing the effect of the drug, helps in bringing the samatva of the doshas. By that, we can cure Roga and Rogavastha. There are different Aushadha Sevana Kala. References are available in our Samhitas. Few references are in Charaka Samhita, Chikitsa Sthana, 30th chapter. In Sushruta Samhita, Uttarasthana, 64th chapter. In Astanga Sangraha, Sutrasthana, 23rd chapter. In Astanga Hridaya, Sutrasthana, 13th chapter. And in Sharangdhara Samhita, Madhyama Khanda, we have the reference of Astanga, Aushadha Sevana Kala. So, to avoid the confusion of different references, here we are going to study Aushadha Sevana Kala according to Astanga Hridaya, because we have already studied in first year. From the exam point of view, we don't want any confusion between the Aushadha Sevana Kalas. So here we are studying Aushadha Sevana Kala according to Acharya Vagbhata, that is according to Astanga Hridaya. And as it is a Bhaishajya Kalpana paper, we are going to study Aushadha Sevana Kala according to Sharangdhara Samhita as well. So now we are going to study Aushadha Sevana Kala according to Astanga Hridaya Sutrasthana. In Dosha Upakramaniya Adhyaya, Acharya Ji has given in detail explanation about the Aushadha Sevana Kala. The shloka is Kapodreke Gade Anannam Balino Roga Roginoho Annadau Vigune Apane Samane Madhya Ishyati Vyane Ante Pratarashasya Sayamachasya Tu Uttare Grasa Grasantayoho Prane Pradushte Matarishwani Muhur Vishachardi Hidma Trit Shwasa Kasishu Yotyam Sabojyam Vaishajyam Bojyaihi Chitraihi Arochake Kampa Akshepaka Hidmasu Samudgam Lagu Bojinam Urdhva Jatruvikarishu Urdhva Jatruvikarishu Swapnakale Prashasyate. So the meaning of the shloka will study now. Ananna. Ananna means na anna ananna. Without the food. In the empty stomach. Or after the complete digestion of the food. The medicine is given in this condition for kaphodreka. That is diseases of Kafaja Rogas or Kafaja Rogas. Balino Roga Roginoho. If the strength of the patient is more, disease strength is also more, then we can give in Ananna. That is in the empty stomach or early morning, that is the empty stomach. Next is second Aushadha Sevana Kala is Annadau. Anna Adau. Before intake of food. This Aushadha Sevana Kala is advised for the Vigune Apani in Apana Vata Dushti conditions or Rogas where Apana Vata vitiation has happened. Then Madhya. Madhya means in between the food. Madhya means in between the food where Samana Vata is vitiated, where it is advised in Samana Vata Dushti. Ante, at the end of the meal. At the end of the meal. That is, there are two anta which is told in Astanga Hridaya. One is Vyane Ante and one is Sayam Ante. Sorry, Vyane Ante Pratarashasya means Vyanavata vitiation is there. Then the Aushadha Sevana Kala is after the morning meal. In case of Udana Vayu vitiation, then the food at the end of the evening meal, Aushadha Sevana Kala is considered. That is, at the end of the evening meal, if the Udana Vata vitiation is there, then Aushadha Sevana Kala is considered. Then Grasa Yoho, Grasanta Yoho. Madhya, in between the food. That is, if there is any vitiation in the Samana Vata or involvement of Samana Vata in the disease manifestation, then medicine is given in between the food. Next is Ante. Ante means at the end of the food or meal. There are two Ante are told in our classic. One is Vyane Ante Pratarashasya. That is, at the end of the morning meal, if the Vyanavata involvement is there, that Aushadha Sevana Kala should be considered. Sayamachasya, after the evening meal, at the end of evening meal, Udana Vata involvement is there, that Aushadha Sevana Kala should be considered. That is, at the end of the morning meal, Vyana Vata At the end of the evening meal, Udanavata, Aushadha Sevana Kaala. Next is Grasayoho, Grasantayoho. Grasayoho means grasa means one morsel of the meal, one morsel of food, one bolus of food. So Grasayoho means along with the one bolus of the food. Grasantayoho means at the end of one morsel of the food, at the end of one morsel of the food. So, in Grasayoho and Grasantayoho, if Pranavata Dushti is there, that Aushadha Sevana Kala should be considered. Muhur Muhur. Muhur Muhur means frequently or repeatedly. Muhur Muhur is Aushadha Sevana Kala is considered in Visha, Jardi, Hidma, Trut, Shwasa, and Kasa. That is, in case of poisoning, if the patient is having vomiting, hiccup, thirst, breathing difficulty, cough, then medicine should be given repeatedly. Next, Sabojyam, along with the food, mixed with food. Sabojyam or Sabuktam, along with the food or mixed with the food. There, Bhojyaihi Chitraihi Arochake. There, in Arochaka condition or in the Arochaka Avastha, medicine should be given along with the food, and the food should be Chitraihi. It should be garnished beautifully, beautifully garnished food or attractive food should be given. Samudgam. Samudgam means the literal meaning of samudga is sandwiching. Okay. So here samudga means at the beginning of the meal, then at the end of the meal. In between meal is there. At the beginning, medicine is given. Then food is consumed. Then once again, medicine is given. So samudga is at the beginning and at the end of the meal, medicine is administered. And that meal should be light for digestion. The conditions are Kampa, Akshepaka, Hidmasu, Samudgam, Lagu Bojinam. Kampa means tremor, or we can consider Parkinson or any kind of tremor. Akshepaka, convulsion or epilepsy. Hidma, hiccup, where medicine should be at the beginning of the meal and at the end of the meal, medicine is administered, where the meal should be lagu bhojana, light for digestion. And then swapna kale, during the bedtime, urdhva jatru vikareshu swapna kale prashasyate. Jatru is clavicle. In urdhva jatru vikaras, the diseases of the regions above the clavicle, the Aushadha Sevana Kala is Nishi. Nishi means night time or bedtime. This is Aushadha Sevana Kala told by Acharya Vagbhata in Astanga Hridaya. So Aushadha Sevana Kala told by Acharya Vagbhata are Anna, Ananda, Bhaktado, Madhya, Anta, Sabhakta, Muhur Muhur, Sabodhya, Grasa Grasantayoho, Samudra, and Swapnakala or Nishi. Now, here we are going to study Aushadha Sevana Kala according to Sharangdhara. In Sharangdhara, Pratama Khanda, second chapter, second to third shloka, Acharya Ji has given Aushadha Sevana Kala, that is, Jneyaha Panchavidaha Kalo Bheshajyagrahano Nrinam. Jneyaha Panchavidaha Kalo Bheshajyagrahano Nrinam. Kinchit सूर्योदये जाते तथा दिवस भोजने सायंतने भोजने च मुहूर्चापि Tatanishi. So the Aushadha Sevana Kala told by Sharangdhara ji is, one is Suryodaya, second one is Divasa Bhojana, third one is Sayantane Bhojana, that is evening meal. Divasa Bhojana means with the day meal. Suryodaya means at the time of sunrise. So next is Muhur Muhur or Muhuschapi. Muhuschapi means frequently or repeatedly. And one more Aushadha Sevana Kala is Nishi. Aushadha Sevana Kala told by Acharya Sharangdhara ji is Suryodaya, that is at the time of sunrise. Divasa Bhojane, along with the day meal. Sayantane Bhojane, with the evening meal. Muhuschapi, frequently or repeatedly. Tata Nishi. Nishi means night time or bedtime. So here, 5 Aushadha Sevana Kalas told by Acharya Sharangdhara. So here in this slide, we are going to compare the Aushadha Sevana Kala references of or references between different Samhitas. Here in this slide, we are going to learn comparison between comparison of Aushadha Sevana Kalas between different Samhitas. In the first column, 11 Aushadha Sevana Kalas are mentioned. Here, each Samhita is compared with Astanga Hridaya, because already we have studied Astanga Hridaya Aushadha Sevana Kalas in a detailed way. So, first, comparison of Charaka Samhita with Astanga Hridaya. In Astanga Hridaya, there are 10 Aushadha Sevana Kalas are told. Same way, in Charaka Samhita also, 10 Aushadha Sevana Kalas are told. When compared with the Astanga Hridaya, Acharya Charaka ji has not given Swapna Kala as Aushadha Sevana Kala. But the number of Aushadha Sevana Kalas are 10, because Acharya ji has given 2 Anta Aushadha Sevana Kala, and even though in Astanga Hridaya also we have 2 Anta Aushadha Sevana Kala, but counted it under one number. Whereas in Charaka has counted Aushadha Sevana Kala, Sayam and Prata as separate Aushadha Sevana Kalas. So when we compare Sushruta Samhita with Astanga Hridaya, Sushruta Samhita has also given 10 Aushadha Sevana Kala similar to Astanga Hridaya, except Swapna Kala or Nishi Aushadha Sevana Kala is not told in Sushruta Samhita. Other than Nishi Aushadha Sevana Kala, he has added Antara Bhukta or Antara Bhakta Aushadha Sevana Kala, which is there in Ashtanga Sangraha as well. So, Sushruta Samhita has accepted 10 Aushadha Sevana Kala, 9 which is told in Astanga Hridaya, except Nishi Aushadha Sevana Kala. Instead of Nishi, he has agreed to, or he has given Antara Bhakta Aushadha Sevana Kala. When we compare Ashtanga Sangraha with Astanga Hridaya, same Aushadha Sevana Kalas which are accepted by Astanga Hridaya is also seen in, which is also there in Astanga Sangraha. Astanga Sangraha Kala added one more Aushadha Sevana Kala, that is Antara Bhakta. So, this is the comparison of Aushadha Sevana Kala between Charaka, Sushruta, Astanga Sangraha and Astanga Hridaya. Whereas in Sharangdhara Samhita, we have seen there are 5 Aushadha Sevana Kalas are there. One is Suryodaya, second one is Sabakta we can compare, that is with the Divasa Bhojana and Sayanta Bhojana, and Muhur Muhur is also accepted, or Muhur Muhur reference is given in Sharangdhara Samhita, and one more is Nishikala is also there in Sharangdhara Samhita. Here, while comparing these Aushadha Sevana Kalas between different Samhitas, we got a word that is Antara Bhakta. So, what is the difference between the Antara Bhakta and Madhya Bhakta? Madhya Bhakta means in a between the same meal. For example, The medicine is taken in between the morning meal. Only one meal in the morning. In between the morning meal, medicine is taken. Antara bhakta means between the morning and evening meal. Between the two meals. Madhya bhakta means between the one or same meal. So this is difference between the Madhya Bhakta and Antara Bhakta, because we have not studied in the previous slides about Antara Bhakta. So here I wanted to clarify the meaning of Antara Bhakta and difference between the Madhya and Antara Bhakta. So here we have studied Aushadha Sevana Kala's comparison with between the different Samhitas. So now we are going to understand, or we are going to study about modern understanding or the modern system of medicine, Aushadha Sevana Kala, that is chronotherapeutics. We'll keep this topic as very brief. What is chronotherapeutics? Chronotherapeutics is the administration of treatment or the intervention with the respect to the circadian rhythm in order to maximize efficacy and minimize toxicity and adverse effects. So, chronotherapeutics is administration of treatment or interventions with the circadian rhythm of the patient in order to achieve maximum efficacy of the medicine and to reduce or minimize toxicity or adverse effect of the medicine. It is also called as treatment scheduling. Here, treatment is scheduled based on the time, day, week, month. Then, in the modern system of medicine, it is a relatively new way of thinking where it is a in the modern system of medicine, this perspective is relatively new way of thinking where thinking about the disease and along with the thinking about the disease, how to treat the disease also takes important place. Here it is called attention to the importance not only quantity of the drug that is administered but also when it is administered. Chronotherapeutics is the administration of treatment or intervention with the circadian rhythm of the patient in order to achieve maximum efficacy and minimize the adverse and toxicity of the medicine. It is also called as treatment scheduling, where treatment is scheduled based on day, week, month, in the daytime or in the night time. It is this perspective is relatively new way of thinking about the disease and additionally how the disease is treated. Here, attention is given to the attention is given not only to the amount of medicine which is administered, along with that, it is also given importance to the when it is administered. So here, chronotherapeutics is a new way of thinking for modern science or modern system of medicine, where they give importance to the both quantity of the medicine as well as when it is administered, time when it is administered. So here we have completed third part of Unit 5 where we studied Aushadha Sevana Kala. What is Aushadha Sevana Kala? Aushadha Sevana Kala according to Astanga Hridaya, Aushadha Sevana Kala according to Sharangdhara Samhita, Aushadha Sevana Kala, comparison of Aushadha Sevana Kala between different Samhitas, and Aushadha Sevana Kala according to modern system of medicine, that is chronotherapeutics. Regarding the chronotherapeutics, we have keep very brief information. So here I conclude this today's class. Thank you.